Well, good afternoon, ladies and gentlemen. Great to be here talking to you today. I have to apologise that our usual spokesperson on health and disability is Barbara Stewart, and she's unable to be here today, so I'm a bit of a ring-in on that. New Zealand First is a centre party. That means it looks after the interests of all New Zealanders, and in fact we claim to be a party that really represented the National Party and the ethics that it had back in before 1980, but has changed very much today. So we're the original, if you like, of the National Party, and we have policies, as I said, for all New Zealanders. The New Zealand First recognises the right of every New Zealander to equality of opportunity. 20% of our population has long-term impairment. In many cases, the real handicap to full participation in society by people with disabilities is not the disability itself, but the environmental barriers, ill-informed attitudes, and inadequate support services. So New Zealand First will strengthen the advocacy role of the Minister for Disability Issues and develop leadership within the disability community. We also intend to increase funding for the ongoing resource scheme, and we have a number of other policies which I don't have time to tell you about right now, but which anybody is interested can come and get a copy from me. So, disabled New Zealanders. In New Zealand today, there are about 100,000 seriously disabled New Zealanders. In many ways, they have been forgotten by our political system, and New Zealand First is going to respond to them. We are going to work with the advocates for the disabled and provide as much relief as we can to improve their daily lives and income. So we're going to build for them 1,000 homes spread around New Zealand to provide them with the housing that they desperately need. Another policy we have, which will be of assistance, is that New Zealand First supports raising the minimum wage to $16 per hour, which will assist paid caregiving. And that completes all I want to talk to you about right now, but I'm very happy to answer your questions. Thank you.